Dr. Travis here. Today we are talking posture, and we'll talk about what is posture, how do we evaluate it, and what we need to do about it, and is it an issue? So the topic is straightening up and how sitting and texting destroys your health. So what's the solution? So we're going to go through all the different aspects of posture, and please, if you have any questions about the presentation or about posture or about health, please comment, send us a message. We'll get back to you as soon as we can. Here we go. Okay, so there are many different types of posture that you can see on an individual. So posture really just means how you are holding your body and how well is your joint alignment stacked against gravity. So vertical against gravity. So you can see the ideal posture. You know, you have your entire weight of your body distributed through basically the center of your arch of your foot. It travels up through the lateral malleolus of your knee, and then it goes up through the hip joint itself. Continues up through your AC joint of your shoulder and then up into your ear. You want those landmarks in alignment with each other so that you have the least resistance upon each of the joints in your spine, your hips, your knees, your toes. We want them very efficient when we're standing. And that's what we're designed to do. We're designed to stand. Human bodies are designed to stand, not sit. And we'll get more into that in more detail. So you can see sway back posture. So basically your hips are forward, military back. So basically a completely straight back, basically. Not a lot of curves within the spine. Flat back, same kind of a deal. And then we have the kyphotic lordosis, so excessive curves within the low back and mid back, neck. That's going to create a lot of brain fog issues when you have excessive curves like that, a lot of muscle imbalances. And then you have the most common, the forward head posture. This is probably what I'll see 75% of patients that come in through will have that orientation. And there's a lot of really good practical things we can do to help correct that. Okay, so deviations in the body's center of gravity caused poor posture, which resulted in intestinal problems, hemorrhoids, varicose veins, osteoporosis, hip and foot deformities, poor health, decreased quality of life, and shortened lifespan. That was a study, posture in the aging and aged body. So Journal of American Medical Association. So, you know, there's a lot of different ailments that can come from poor posture. You know, we degenerate as we age. So simply by living, year after year, our bones are starting to degenerate, and that's why you see grandma and grandpa kind of hunched over in that position as well, and having these circulatory issues, bone issues, and just their quality of life has decreased because it reduces your ability to be active and move, as you see in that depiction. Standing to hunch to cane to walker to wheelchair. We want to avoid that. We want to decrease that progress as much as we can, and we'll talk about how we do that.
Click on the slide again.
Okay, what's the problem? Physical inactivity and chronic poor physical inactivity. So sedentary life, basically. So our total energy expenditure is a third of our ancestors. So we just don't move as much as we have in the past, because we don't really need to, right? We don't need to go hunt our food or run up mountains to get to water. There's many reasons why we're just, especially our society, right? We're working all day in our desk chairs, and we're just not, have cars. So we have to change with our environment. Physical inactivity and poor posture contribute to obesity and all related health problems, right? So you're not moving, you're not active, your heart's not pumping as much, we're not using as much energy. You create obesity, you create this metabolic type disease. These are all in association with the way you hold yourself upright. Okay, we're over fat, we're under muscled due to sedentary lifestyle. Decreased lean muscle is a huge risk factor for cancers, breast cancer, colon cancer, these kind of site-specific cancers. Poor posture is one of the biggest causes of osteoarthritis because we're having too much friction upon different areas of the body. Big winners is knees and hips. Those are probably the biggest joint replacement surgeries that I find when people come in. And then just decreased quality of life and lifespan. And we'll talk about why that is. What specifically does that even mean? How do you decrease the quality of your life or your lifespan due to poor posture? I'll get into the specifics later. Okay. So there's no running away from it. The more you sit, the poorer your health and the earlier you may die, no matter how fit you are. Okay. Basically, sitting is the new smoking. Okay. We sit so much and we got so used to sitting that it's a normal in our everyday lives, right? When you're at home at the couch, you sit in the car to go to work, you sit at your desk, and you come back home, back in your car, you're sitting, back home, you're at the couch, you're sitting way too often. And this creates a lot of sedentary type lifestyles, but also, many other sedentary type diseases that will come across with that. So, just sitting at your job, twice the rate of cardiovascular disease compared to people with standing jobs. Sitting 6 hours a day, makes you 40% likely to die within 15 years than someone who sits less than 3 hours, even if you exercise. So just because you think you exercise an hour out of one day, when you sit for 9 of those hours, that isn't compensating for the increased, sitting hours. I mean, that there's that just because you exercise does not mean that you're countering that. Okay, so your text neck, your forward head posture, one of the biggest, issues of our society today, especially because so many people online right now, right? We're all looking down at our laptops, our phones, our computers, and we've literally created kind of like a landmark, so to speak, with X-rays. I don't know if you can see that picture here, but that little horn coming from the bottom of his skull is due to the excess pressure and tension of the muscles and tendons that connect to your skull there from excessive flexion or forward kind of looking down like this. Okay, puts a lot of tension right at that point. Okay, and over time it grows and grows and grows when you don't give it break to heal. Okay, so for every inch forward head posture is increase the weight of the head on the spine by an additional 10 pounds. Okay, so every inch. So you have talking, 3 inches, 30 more pounds of stress on the neck, spinal cord, muscles, tendons. Okay. Forward head posture can add up to 30 pounds of abdominal leverage, cervical spine. This can pull the entire spine out of alignment. Okay. So forward head posture results in a loss of vital capacity of the lungs by as much as 30%. So this is where we start talking about the longevity piece of it, right? So, and the lifespan, the life quality, because when you have this forward head posture, okay, and I'll just kind of get into it now, but basically when you have your head forward, okay, you're affecting so many other areas of your body when you have that, okay? Because what happens is your head goes forward, your shoulders are going to follow. Okay, and they actually internally rotate, causing really tight pecs, and your actual rib cage will start to collapse forward. Okay, and what that does, it actually puts pressure on your lungs. Okay, it reduces your vital capacity to breathe. Okay, why does that matter? Well, your lungs is how you get oxygen into your blood. Okay, so when you don't have a big enough breath to basically absorb that oxygen into our cells, you get lack of blood flow, lack of oxygen within the tissues of our cells, our brain, and it creates a host of all these different illnesses. So being able to breathe properly is a huge component when we're talking about forward head posture, posture in general, and of course the degrees of your head positioning as well. I can see there. Okay, so poor posture reduces blood flow and oxygen, like I mentioned, to the brain by 30%, adds excessive compression strain to the spine. We talked about that, and slows reaction time, right? You're putting pressure on your central nervous system, your spinal cord, your brainstem that comes through here. You know, basically the tighter you put that tension spot in your neck, the more reduced neurological activity or activation will occur. Okay, that's why the reaction time can actually be slower, because you're pulling so much tension onto those nerves. Okay, magnifies the feeling of panic and helplessness. So now we're talking about sympathetic dominant systems, right? You are so ramped up, you're go 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 go. That creates anxiety. Okay, panic, because again, that area of the spine and the neck, it has to do with your parasympathetic system. So if there's dysfunction there, you're not going to be able to get into that rest and digest, that calming state. Posture follows movement like a shadow, the ultimate rigidity, rigor mortis. So basically, power is your ability to move or travel with great speed or force. Okay, flexibility and mobility. So you got to think of distance plus a full range of motion to flexibility creates your ability to produce power. Okay, so we want to be limber and we want to be able to not be rigid, so to speak. Okay. If movement is the solution, what keeps you from moving? Pain. So the reason why many of us don't do the movement that we need is because we're in pain. And usually that pain, affects something that we want to do or something that we need to do, right? And we don't have the motivation to move properly if we can't do that without being pain free. So that's number one, we got to get you pain free before we can even do any kind of correctional interventions. So how do you get rid of pain? Chiropractically, talk about subluxation. So subluxation, here's a simple kind of diagram describing what we do as chiropractors. You can see there's a normal alignment within that spine on the left. You got the spinal cord, you got the bone, you got the disc, got the muscles that connect to those bones. There's no additional pressure within that nerve right there in the yellow. Now, when you have a subluxation, so basically that bone shifts into a position that is not ideal. Okay, it basically pulls on the muscles tighter, and then what that does is it also puts tension and pressure upon the nerves exiting that area of the spine, and that's where we get the lack of the neurological activation. So you can see subluxations block the normal flow of electrical impulses from the brain to the body. Okay, so we're literally turning that switch on, so to speak, so that your brain can communicate to all the other tissues of your body. Okay, your muscles, your organs, your glands, everything we want to be working 100%. Okay, so there's different areas of the spine that control different things. Okay, we got the cervical spine, thoracic spine, lumbar spine, sacrum, coccyx. Okay, and you can see what they all control. So if we have an issue within specific regions of the spine, it's going to affect different symptoms. Okay, so upper neck, we're talking immune system. We're talking your autonomic nervous system. We're talking your head, your face, your sinuses, nerve, inner ear, sympathetic system, eyes. So everything you can see kind of up here can be affected to the cervical neck. Okay, and your arms, your head, your shoulders, teeth, right? And as we go down through the spine, they control through the thoracic spine. It's more of the organs, okay, affecting your digestion, your liver, adrenal glands, kidneys, things like that. And then low back. Now we're talking some more reproductive, kind of bladder, digestive, and lower body, kind of legs, toes, feet, things like that. So we want proper alignment, proper posture, proper curves within our entire spine, so that they don't have excess pressure or irritation that create these issues. Okay, so forward head posture, how do you know if you have it? Well, you can take a simple picture, and anybody who you can take a picture of it just on your phone, and you can tell if somebody's head's more forward compared to their shoulders. Okay, it's a really simple task, but we can actually identify specifically how much and how to change like hips or ankles or um, knee position as well. So how do you know if you have to take a picture? Here's a before and after of this guy. He actually did the 8 weeks of wellness program, so you can see he did quite well. But notice how well his posture changed over the course of even just 2 months, right, or 6 months. So that's significant, and a lot of this, it doesn't necessarily have to do with his structure. Okay, like there's going to be a little bit that has to do with the actual stacking of each of your joints from your feet all the way up to your head, but a lot of this has to do with your proprioception. Okay, so are you conscious of where your body is in space? Okay, posture has a lot to do with how well your nervous system is communicating to the muscles of your body. Okay, so yes, we want to be aligned structurally, but we also need to take in consideration of nerve health. Okay, can you even feel what you're stepping on technically? Okay, so that's kind of a good analogy. If you're walking around in these shoes all day, right, you have no idea if you're leaning to the right. If when you walk around barefoot, you can feel everything you step on, and you're going to change your posture and your position based on what kind of environment you're in, whether you're standing on rocks or sand or concrete floor. It's all going to change. This gentleman has what we call end stage forward head posture. Um, and you can see there, he's pushing 5-6 inches forward head posture. Now that's very unhealthy, not just for his spine, but for his entire spinal cord and brain, cardiovascular system, digestive system. We're talking multifactorial issues here, just from a really bad posture. Okay, so it's kind of like a trickle down effect. We want to identify where you are in your posture, so we can make sure that you don't go get to this point, basically, because once you're to this point, this is very difficult to correct, and it's going to take a lot of work, a lot of time, and the results probably pretty limited for this individual, since he looks elderly. And he may even only be like 50 years old, but he's breaking down so fast that he maybe looks like he's 80. Okay, we don't need to get into the like super technical terms here, but basically, what I was mentioning before is your nervous system is going to control how you hold your body upright. Okay, and these muscles, so the nervous system controlling the muscles to hold or keep something stable in the right position. So if you don't have things, you don't have certain muscles contracting correctly, you don't have the flexibility in certain muscles, you're going to create an imbalance, and you're going to create this, again, this forward head posture, as you can see, and how it affects the body. So again, trickle down effect. It's everything's going to compensate. You're going to compensate in the front and the back end all the way down, which is going to create a really poor alignment within your entire body. So it's, we're talking about reciprocal inhibition. So basically what that means is, as one muscle contracts, the opposite muscle is going to relax. So as I contract my bicep, reciprocal inhibition means that because my bicep's contracted, that means my tricep is relaxed. Okay, it's just the opposites. Okay, that's the same, that goes true for posterior chain or anterior chain. So what does that mean? Posterior chain is all the muscles on the backside and anterior chain is all the muscles on the front side. Okay, so they have to be in a good relationship. So we want very strong posterior chain, and then we also want good core stability and strength too. Okay, upper and lower cross syndrome. These are diagnoses that talk about these postural changes. Okay, so upper crossed, what we've been preaching this whole presentation. The forward head posture. So basically, the front neck flexors are very weak. Okay, so that prevents your head from basically staying backwards. So your head goes forward. Your pecs are extremely tight, so now they're pulling your shoulders forward. You have weak rotator cuffs again, so that's why you have that kind of rounding of the shoulders. And then you have tight suboccipitals. So these are very tight, so it creates that head to kind of jut forward too. Lower cross syndrome is more talking about the hips. So very tight hip flexors. So your iliopsoas, those get extremely tight when we sit for long periods of time. Inactivated glutes. So basically, when you sit, you're not using any glute muscles at all. When you stand, you are. And what that does, it creates the pelvis to rotate anterior. Literally almost every single person that comes to the office, I can almost identify that having this. It's super common, just because we normalize sitting as something that's totally fine, and when it's not, you have to come up with creative solutions to change our habits, and that's really what this is going to come down to, is behavior, and how do we change our habits, our routines, our behaviors, so that we can prevent these things from occurring to us. Okay, tight muscles and fascial adhesion. So every muscle, every nerve, every bone basically is going to be wrapped in this stuff called fascia. Okay, you can see in that picture there, it looks like spider web. It's like fishing line. So think of like fishing line wrapped around every single cell of your body that's connecting everything together. Okay, so we don't want to think of posture like as a reductionist kind of a view. It's very many muscles involved at once. We're talking whole movement systems rather than like a specific muscle that's tight. Okay, so your hamstring is a perfect example of this, because the emergency brake, right? So it's the human emergency brake if you have a tight hamstring, because it basically prevents you from being able to run fast, or or even have a proper gait, because you're gonna land on your heels, and the heels, it's gonna stop you. So again, it's all about the pelvis positioning, making sure that you don't have muscle imbalances, and make sure that the hamstring has full range of motion. Again, as you can see, hamstring, pelvis, knee, foot and ankle, all these systems are related to each other. Okay, it's not just one thing. One thing can, poor footwear can cause knee pain, or poor footwear can create your hips to be out of balance. Okay, so you have to look at a whole body approach rather than something very specific, like I have foot pain, so that means that the issue is in the foot. Not necessarily. But fascia, these adhesions will build up over time, and when they build up too much, it creates a lack of motion. Okay, and it creates scar tissue, and what we have to do is break up that scar tissue when it's a chronic issue. Okay, so if you have poor posture for 10, 15, 50 years, you're going to create a lot of dense scar tissue because you don't have proper movement to move that fascia, and it's gonna lock you into a very poor position. So there are tons of techniques you can do to break up scar tissue, or manipulate fascia through scraping, and there's stretches and releases that you can do. So if you have any questions, obviously just please reach out, and we can answer them for you. Okay, so this is what we do in the office. You can see that posture evaluation. So we're looking at a front and a side view, and then we can actually measure in inches, like how far off you are, and we can measure to see if you want shoulders dip to one side, or if your head is tilted or twisted to one side. It just lets us know more specifically what's tight and what's weak, and that way the protocol that we give you is very specific for your individual posture, not just some everybody needs to do this, and you'll get better. But we do want to go through what we call like mobility stretches as well, strengthening exercises, stability exercises, again, because we have to identify what are we strengthening, what are we flexing, what are we stretching. Okay, we need to cater it to each individual. And then mobility overhead squat. So this is a test that gives you a lot of information of how well somebody's mobility, flexibility, ability to move their spine. As you can see, the guy on the left, perfect form, right? And you can check out those angles there as well. But having the ability to do that positioning requires a lot of, mobility in the shoulders, flexibility in the ankles. There's a lot of different things going on there. But this is another tool that we'll use. And then some basic, mobility exercises. So there's a hip mobility. And these are all things that we'll teach individuals as they come through the office on how to do this at home. That way, we give you some power, how to combat this. And again, this is something you can build into like a daily routine. You wake up in the morning, do some stretches, do some exercises. A little bit goes a long way when we talk about using foam rollers, doing a simple hip bridge. I constantly tell people to do hip bridges because they have low back pain. Hip crossovers, lunges, split squats, these are all really simple exercises that you probably have done before in the past. You just forget about it. Shoulder mobility, same thing, wall angels, using TheraBands, using the dowels to get shoulder mobility. Again, a lot of us don't do a lot of overhead movements, right? Unless our job requires of it. So we're typically going to lack that external rotation and just being able to put our hands above our heads, because again, we don't do a lot of activities like that. So cross-body stretches, this is good. Floor angels, like I mentioned, shoulder pass-throughs. Evaluation, but also exercise. The ultimate rigidity. So you may have heard the word rigor mortis, right? So that's what happens when you die. Okay, so basically, all your muscles seize up and they're in a chronic contracted state because they have no energy going to them. Okay, so and that's why if you're stiff, if you're rigid, you're technically closer to degeneration, or I don't want to say death, but you're moving there quicker than you need to. And that's why movement is really the solution to longevity. Okay, guys, so we do have a deal for you. If you haven't been to the office before and you're watching this, we do give a discounted rate for attending this posture presentation. So we will give you a posture and mobility assessment plus a full wellness exam for $49. Typically that's more than $99. And then if you're a current patient, we'll do a posture and mobility assessment for $30. Which is great because you'll get to work with the movement specialists, and we'll be able to do some posture evaluation pictures and then be able to track this as you go through a series of posture correction exercises and adjustments if you need them. So this offer is good for anybody that you send it to, basically your friends, your family, children, spouses, coworkers. Just let them know that we're here, and I've been doing posture correction for my entire career, done, posture certifications. And so there's a lot of different posture exercises we can dive into. And we have a protocol built in to give you the best results. So again, if you guys have any questions, please send them our way and give us a call.